Okay, we're back and time for cocaine 2. So here's a nice sample question. If a drug slows the presynaptic neuron's ability to gather up the neurotransmitter, we call it A, an agonist, B, a neurotransmitter recycler, or C, a reuptake inhibitor. And I do hope you picked C. An agonist is just a drug that makes the neuron fire essentially the same way as a standard neurotransmitter. A neurotransmitter recycler isn't a terrible name, but that's just not what we call it. And finally, C is a reuptake inhibitor. And again, we'll see these again when we do the psychiatric notes. Okay, this guy first extracted cocaine from the leaves. Is it A, Hoffman, B, Neiman, or C, Freud? All right, I do hope you picked Neiman. Hoffman was the guy who basically discovered LSD. Neiman, this was actually his dissertation, believe it or not. And then Sigmund Freud was, big on cocaine, but he wasn't the guy who actually isolated it from the leaves. Oh, this father of psychoanalysis praised cocaine in the late 1800s. Now, obviously, you'll have an advantage if you took abnormal or any of the literature classes that seem to play up Freud. But bottom line is, this is Sigmund Freud. Sullivan is a later Freudian, but worked mostly with psychotic people. Ellis is one of the fathers of cognitive behavioral therapy. Fritz Perls actually started the Gestalt and humanistic psychotherapy movements. So again, this is the right answer is Freud. Oh, this was an old cartoon about Whitney Houston, who literally sold 200 million records. I don't know if you guys would even know who she is anymore. She died in 2012. She was only 6 months older than me. It was pretty tragic. She lived pretty hard. A lot of folks say cocaine is God's way of letting you know you're making too much money, and clearly this got to be trouble for her if she's snorting it for performance. Yes, the ridiculous habit. This is just an example of insufflation. Why folks do it off mirrors, I'm never quite sure of. There's nothing weirder than looking up your own nose, I'm sure. Um, Basically, other than Pape, that insufflated South American tobacco-related snuff type thing, you really don't want to put stuff up your nose. It's just not a good habit. Well, so we got the acute effects down. Let's take a look at the chronic effects of cocaine. So one of the most well-known is formication hallucinations. This has a whole bunch of crazy terms. Ekbom syndrome, parasititis. The names of the delusions are curious, but the bottom line is it's that subjective effect. You feel like bugs are crawling under your skin. And so you'll see this with meth as well, that folks are kind of scratching, and they really do claim it feels like they've got bugs under their skin. Some folks, well, it's got a bunch of slang terms. Continuously stuffy or runny nose, I can hardly point any fingers at that, given how I've been. But bottom line is this bleeding of the nasal membranes. In the 70s, I knew two people who had to have nasal surgery. The nasal pharynx just starts to wear out after a while. And then intense cocaine craving. It looks like both craving and euphoria from cocaine are pretty well linked to that dopaminergic system. And this seems to be one of the big predictors of lapses and relapses. The time from first use to basically developing problems is relatively short. This is a dangerous drug, and it's even worse for crack. And looks like some data suggests it may be worse for women than for men, depending upon the stage of the menstrual cycle. So definitely don't want to mess with this stuff, and the chronic effects are clearly not pleasant. I should add there's all that cardiac stimulation, so you definitely put yourself at risk for heart attack, really, or any other cardiovascular complications. And subset of folks smoking crack get basically crack lung, which is this like bloody cough. It's really pretty nasty. What's going on here? Well, basically the red And orange here is where the blood is flowing. You can see on the cocaine one here, you got much more blue, markedly less blood flow to this frontal cortex. And unfortunately, that frontal cortex is the part of the brain that helps you inhibit dominant responses like the response to go ahead and do another line. You'll see folks say, gee, the bottom of this 8-ball wasn't as good as the top, and it's not that. It's that they've really just run out of transmitters after a while, and more cocaine is not going to be better by that point. And it's unfortunate that your frontal lobe, the part that would help you stop, is actually impaired in response to the drug. So you can see this addictive cycle can be pretty serious. And we do see neuropsych deficits in long-term cocaine abusers. And there is recovery after a month of sobriety. So definitely worth getting off this if you're having a problem with it. And again, this is one of the ones I really just can't recommend. So the physical signs of abuse are basically a combination of both the acute withdrawal and acute subjective effects. So obviously great big pupils, an increased heart rate, but the irritability and paranoia often come from probably a correlate of just the lack of sleep. So when your sleep is disturbed, of course, you're going to have some of these. Paranoia may be linked to the fact that the subjective effects are that the thoughts seem to be coming faster, and you have a higher proportion of paranoid thoughts under those circumstances. If you think about it, evolutionarily, we probably got to pass our genes on if we got a little paranoid when we were aroused, but obviously this is an artificial arousal and going to be rough. Sneezing and irritability in the nose, again from that just irritation. Feelings of depression. So almost invariably, when you run out of these neurotransmitters, the next day you're going to be particularly bummed, and the contrast to how happy you were using it's got to be pretty stark. Comorbid depression is a pretty common side effect, common to cocaine dependence, and antidepressants alone don't seem to help anywhere near as much as we had hoped. Insomnia, again, any stimulant's going to contribute to that. We talked about good sleep hygiene and ways to battle that instead of using a sedative on top. And then decreased appetite and significant weight loss. This is, again, only at really high doses, so it's definitely not a weight loss strategy because there's that rebound binge eating afterwards. So this little white rat seems to be enjoying his cocaine. The data on this suggests, man, rodents at least will do some pretty horrible stuff just to get a little cocaine. So they're just ethically horrendous. They'll make rats swim through cold water, or they'll make them go across these electric shocks, and they will do it in order to get it once they've reached maintenance. There may be a strain that, a sort of species of rat that doesn't have it as badly. Folks were working on the cocaine vaccine. It just doesn't seem to be working. This is really a tough drug to deal with, and the animal literature is extensive, and we still don't have a lot of insights into that. So the journey of coca to crack, I just want you to understand, first of all, this requires a lot of pretty nasty chemicals. So if you trust your local guy who probably learned it in a back alley, it's not a good process. So the coca leaves are turned to coca paste, usually with a solvent, and then that paste was put in these big vats when folks are dealing with a lot of leaves, and occasionally somebody would put a cigarette in there, and then apparently in Spanish call that base. And then depending upon whose story you believe, some guys up in San Francisco said base, oh, we know how to make a base, right? And so they combined cocaine with a relatively strong base, but now folks just use baking soda. So this powder to free paste is basically going to take that hydrochloride portion off the salt, and then it can be smoked. So to get cocaine hydrochloride to melt, you've got to get it at an outrageously high temperature. I hear about folks throwing it in their tobacco or throwing, intranasal cocaine on a pipe. It's really not going to work. It's just a complete waste. But once it's been combined with the baking soda, you do have a smokable form. So powder to crack cocaine through treatment with baking soda is literally perhaps part of the legend of the name crack. So as it's forming that precipitate, apparently it makes a cracking sound. Uh, I told this story in group therapy for crack abusers, and they laughed their asses off. And they said, "Oh, Mitch, you're so funny." Uh, I was like, "Well, why do they call it crack?" And they said, "Because you crack off a bit of the rock and you try to smoke the little piece." And I was like, "All right, well, whatever you guys say." But the bottom line is we're going to go from leaves to the paste that's the hydrochloride is formed with basically mixing it with hydrochloric acid and then adding baking soda to create the precipitate that is a smokable form. The other smokable form was freebase, which, whew, man, you got to really want it. But basically, you're going to dissolve the powdered cocaine in usually ether or some solvent. Now, ether is incredibly flammable. So if you know Richard Pryor's story about getting all burned up freebasing, it's obviously an incredibly high risk. Here you are, jittery and high and stupid, and then you're going to take a flame to a highly flammable thing that's a solvent and light it on fire and try to be able to smoke it and get the effects factor. It's faster. It's just really not a good habit. All right, I just wanted to have a picture of it, but so they're using kerosene and ammonia here for the solvent. This potassium permanganate is just a part of a filter. Bottom line is if you know that it's combined with the cocaine hydrochloride is added through this process and then made into a precipitate with baking soda, you got the big idea. And then these are just a few cocaine facts just to know. So the average leaf is really only 2% cocaine. This is sort of why I feel like the chewing of the leaves is probably nowhere near the problem that we have with intranasal and smokable forms of cocaine now. And I don't really understand the laws against that, and that's why it's probably not having a horrible impact in South America. Bazooka is that paste put in tobacco, but they also call it Baze. Vin Mariani, as I mentioned, that's cocaine dissolved in wine. And that does form coca-ethylene. I'll talk to that in a second. 1903 is when Coca-Cola lost its psychoactive cocaine, but they still use the leaves. Obviously, I'm perseverating on that date, so that one's probably worth knowing. So the cocaine plus alcohol does make this coca-ethylene. Carl Hart, actually, the guy who wrote your textbook, showed that it definitely has a longer duration, but probably, at least from his data, not as dramatic a change in subjective effects ounce for ounce. But it's hard to control the doses and basically make sure an equivalent amount of cocaine and coca-ethylene is in the experiment. Truth be told, mixing these two is just not a good idea because the alcohol does slow the metabolism, and definitely still a local anesthetic, so it's still used in that eye surgery and things like that. So with that in mind, I wanted to kind of show how basically late 70s, early 80s, this was an expensive, insufflated powder, in part because $25,000 in 1983 was a decent salary. This was usually an upper class thing. A friend of mine who worked on Wall Street just a little after this said almost everybody in the pit had cocaine. And it was this basically luxury item. But once folks figured out how to make crack, the typical cocaine abuser had not gone to college, earned less than $25,000 a year, and was more likely to be smoking crack. This really, because it was such a rapid onset and such a dramatic up and then down, the time from first use to dependence problems was much briefer and markedly more problematic than insufflated cocaine, but not that insufflated cocaine is in any way safe. So these are already 2 decades old, but in fact the map looks almost exactly like this even now. So you'll see basically they test the based on basically wastewater, based on what's in the the urine in the area, who's got the most percent positive, and so if you're close to Mexico or a border, so down here in Texas, this edge on Arizona, and down in Florida, you see a lot of cocaine. And then around some of the bigger cities, it's rather unfortunate, we also see this light blue. So this was basically how it was transported. And it's kind of sad because this sort of picked up right after some of the big crackdowns on cannabis. Uh, Here's a drug that's much more expensive, markedly smaller, and easier to hide than a big old plant. So this is what folks turn to often when the anti-cannabis laws were starting to get enforced and became more dramatic. So if you had to guess, cocaine is it in the cola nut, is it in Coca-Cola back in the old days, or is it in Vindana? And I do hope you picked Coca-Cola. Vindana is just me making up names. The cola nut has caffeine in it, not intranasal cocaine of any sort. And okay, bugs under the skin. What is that called? Is it bugging out? B, formication, or C, fornication. Obviously, B, formication is the right answer. And that's that delusion that bugs are crawling under your skin. Obviously, fornication is something else. All right, and cocaine plus alcohol makes, is it rum and coke, coca-ethylene, or ethycocaine? And I do hope you picked coca-ethylene. Well, I'm going to pick just some highlights in the cocaine treatment options. I want to emphasize treatment outcome on this is just not good. I think folks who can quit on their own often don't end up in treatment, but there was an inpatient, often 28 or 21 days inpatient to try to help. It doesn't seem to be turning out any better than just standard outpatient treatment, and then folks learn how to deal with their own environment. Anybody can quit when they're in a lockdown facility, but can you quit when you're in your regular neighborhood? Shortened inpatient program followed by intensive outpatient is probably the best, just so you get a chance to come down and experience some withdrawal under medical supervision. Treatment strategies include Cocaine Anonymous, so that's the 12-step group. Truth be told, any NA group will gladly take you if cocaine is your drug of choice. In the late 80s, there was Cocaine Anonymous in almost every major city and really focused on that. Now it's not so popular. The cognitive behavioral therapy is really all about, making new behaviors that are consistent with your values and changing your thoughts about this. So one of the most common thoughts associated with cocaine dependence is cocaine's the only way to have fun. So obviously that's not true, and start filling your day with activities that matter to you. The temptation to use cocaine can decrease. The Q exposure I thought would work better, but like having folks literally insufflate just some white powder, but that it's not psychoactive, as odd as that sounds, a couple of folks have had some good luck with using that in therapy just because it's easier to keep your mind about you when you've got to use your drug refusal skills and things along that. The pharmacological treatments, none of them are FDA approved, in part because none of them are consistently working in the treatment outcome studies. So we don't see methylphenidate or Adderall, any of the other stimulants really doing the trick, other than maybe decreasing dropout, so folks might be more willing to stay in. There may be a subset of cocaine abusers who do have ADHD, just undiagnosed, and they seem to benefit, but we haven't done the big randomized clinical trial with just folks with ADHD, so we're not doing great. Now, Carl Hart, again, the guy who wrote your book, showed that methylphenidate can decrease craving in crack smokers, and had them in the lab and basically You know, it was pretty amazing. After 2 weeks of being on methylphenidate, they claimed that they weren't craving as badly when they're exposed to all the cues. They literally have to hold the pipe up, they have to light a lighter and stuff like that. Like it's definitely craving inducing paradigm, but it just doesn't seem to be working well. So to have a 20% success rate in one of these shortened inpatient and intensive outpatient programs is actually pretty impressive, which kind of emphasizes how sad this is. And then, yeah, just wanted to emphasize that Spark, St. Peter's Addiction Recovery Center, if you are struggling with this, it's a good combo program. The treatment options are pretty much the ones I emphasized. It's a rough road to hoe. So I really focused this one. So truth be told, I think you've got the key issues here. If you answered these questions well, I'll also have the Kahoots. And the crossword puzzle is, I thought, pretty entertaining, but I had a good time writing it at least. I'm going to stop it here rather than go to an hour, and hope you guys can just focus on this. I really appreciate you coming along for the ride.